Okay. Well, welcome. Oh my gosh. Again, thanks everybody for joining us today and hanging in there with us through this all. I'm going to make this super brief. So we're here today with Dr. Schuster. She's going to be presenting on menopause and then a naturopathic approach during cancer treatment and beyond. We're cancer support community. So, if you're not familiar with us, we are an affiliate with worldwide, national, and largest professionally led nonprofit in the world. And so we're able to bring workshops like this to you guys, among many other things. So with that said, I'm just going to pass it real quickly over to Abra, and she's going to do a brief intro of Dr. Schuster. And that's going to get started.
Thanks, Caitlin. All right, so we are so excited to have Dr. Schuster here with us today to talk about menopausal symptoms. Dr. Schuster is a licensed naturopathic physician who received her doctorate in naturopathic medicine from Bastyr University in Seattle, Washington. She has extensive experience working in integrated oncology settings, including Swedish Cancer Institute and Northwest Medical Specialties. In addition to working with patients diagnosed with cancer, she has a focus on helping patients who have been diagnosed with complex chronic health conditions, autoimmune diseases, women's health issues, and fertility concerns. She received an honors in counseling from Bastyr University, as well as graduated from the New England School of Homeopathy. Dr. Schuster's approach to medicine is to assess each patient as an individual, keeping their whole health in mind, including mental, emotional, spiritual, and physical well-being. Her emphasis is preventative medicine with a strong foundation in nutrition and lifestyle modifications. She utilizes a combination of conventional therapies as well as botanical medicine, nutraceuticals, vitamins and minerals, pharmaceuticals, homeopathy, and hydrotherapy. Dr. Schuster believes that each person's unique story needs to be heard in order to get to the root cause of their ailments. So we're very excited to have Dr. Schuster with us today and want to go ahead and give it to her. Thank you, Dr. Schuster.
Thanks, guys. Thanks, Abra. I'm Dr. Schuster, and that was an excellent introduction. I will kind of head on in. We'll dive on into menopause. And I apologize, there's someone mowing their lawn outside. So if you can't hear me or you need me to repeat something, you can put it in the chat box or raise your hand in one of the chat boxes. And hopefully that's going to stop. It looks like actually it's blowing leaves. So that should stop momentarily. So again, if you can't hear me or you need me to repeat something, just, put it in the chat box and I will try to potentially answer questions because it's a small group throughout, but I will definitely get to all the questions at the end. And we should have more than enough time. We should get it all done today. It takes about 45 minutes to go through this. So we should end right on time. All righty. So I am going to talk about menopause, what happens, why things happen in the body, how to support it during cancer treatment and beyond, because this is not just, I don't know, each individual here where they are in terms of their health picture, their diagnoses. So at times there will be things I will talk about that may be contraindicated for your care. And I try to note that, but I don't always. So my little 2 cents is always to make sure whenever you add something new to a plan or a treatment, you speak with a knowledgeable healthcare provider, whether they are a naturopath or a nurse practitioner, PA, MD, DO, whomever, because contraindications can occur, side effects can occur. So not everything that I'm mentioning today may be appropriate for you. All righty. So what is menopause? Well, that is a good question. And something that I really wish that they taught more in school. I think that maybe they mentioned it a little bit in a health class, but as a teenage female, male, it kind of just goes over our head. We don't think much about it until we start to experience some symptoms and what we think may be menopause. So what are those common symptoms, and a little bit why do they occur? And here we'll definitely talk about some natural ways to balance hormones, from lifestyle, diet, nutrition, exercise modifications, and any things that one can do throughout any phase in their life, whether they are perimenopausal, premenopause, postmenopause, menopause, wherever they are. So we'll talk about that. Just some of those foundations in terms of health. I will answer, hopefully, some common questions that I get a lot. Things about hormones, such as bioidentical hormone, or BHRT, and HRT, which is hormone replacement therapy. I'll answer some common questions about soy as it relates to menopause, and alcohol as it relates a little bit to menopause, but also just to overall health and well-being, because there's some new information out there about alcohol, as well as its role in menopause and menopausal symptoms. And then lastly, if we have enough time, I will go through some tips and tricks in regards to things that can be done safely for hot flashes, vaginal dryness, and ways to support bone health to prevent osteopenia and osteoporosis. So hopefully this all sounds good to you, and we'll just dive on in. So again, this is just the fine print, the little caution note, as I mentioned, and I'll mention it throughout again. There are things I will be mentioning today that may not be good for everyone here. So if you're going to add something in, you're going to adjust a plan, you always want to talk to a knowledgeable healthcare provider. I also just want to make a little note about sex and gender. I sometimes will be referring to women and female, and what I mean by that is anyone born with a uterus or an ovary. Individuals born with a penis also during certain treatments can experience hot flashes. And if there are any men present today, a number of the things that I'm going to be mentioning apply to you as well, or individuals born with a penis. So, what I am speaking about today can really be applied to everyone, every individual. But again, keep in mind, there can be contraindications, so speak to a healthcare provider. Alrighty, so what is menopause? Well, first and foremost, I really want to drive home that it is a normal transition. Menopause is defined as the cessation of menses or periods, and this is caused by the body's decrease in production of sex hormones, specifically estrogen and progesterone. And generally, actually not generally, the average age for menopause is 51.4 years old. So that's the average age, and that's kind of a bell curve. So some individuals can be, in their 30s and go through menopause, and that's an early menopause. And then even, I have patients that are in their late 50s, early 60s that have not yet gone through menopause. So the average age is 51.4. Surgical menopause, which is very common, is caused by the removal of ovaries or ovary and or uterus. That can start to set off menopause or menopausal symptoms, or chemical menopause, which is often what occurs during cancer treatment, or on certain medications that may be individuals may be put on during cancer or in other situations going on in their life. So I don't differentiate too much during this presentation today, whether it's surgical or chemical or just the average menopause, because honestly, from a naturopathic standpoint, actually a lot of the things can be applied through any transition. So there are three major phases of menopause. Initially, there is a climacteric phase in which periods become very irregular. So they can become very light, they can become very heavy, they can happen more frequently, less frequently. You can go months without a period. You can go, all of a sudden you're having periods every 2 weeks. And this is often when I really start to see patients. They come into my office because there's like, something has changed and it doesn't feel right. And my periods are all over the place. And so we start to talk about that. But that is normal. That is what happens in the body. And I'll show you why in a moment.
Get my
Could you hear me okay? Was that a question?
hear this.
Oh, I couldn't quite hear that. Anyways, if there is a question, just put it in the chat box. Actual menopause, it is the last menstrual cycle. So, and this is often diagnosed in retrospect. So, this is the year, the complete year without a menses, without a cycle. And then after that 1 year mark is considered post-menopause. So really menopause lasts the year, but perimenopause or premenopause, when cycles become irregular, that can last anywhere from like 8 years to 10 years. And perimenopause also is similar, 8 to 10 years. So it's menopause is really that one single year, but we kind of generalize it to any of the 3 phases. So this, I think, is just a great illustration, an excellent illustration of what is going on with your hormones, premenopause, perimenopause, and postmenopause. So kind of, but 20, 30-year-olds, generally speaking, they have a rise in estrogen that then leads to a rise in progesterone, and then you start to menstruate or not, you become pregnant, and then hormones just continue to rise. That is premenopause. And so that's kind of, you see these patterns that kind of happen every month generally, of changes in hormones. Perimenopause, where cycles start to become irregular, things can kind of look like that. Hormones are a little bit all over the place. There's rises, there's falls, there's plateaus, there's ups and downs, and everywhere in between. And then postmenopause is kind of a flat line. We see a rise that stays elevated of FSH and LH, which is the follicular stimulating hormone and the luteinizing hormones, and they stay elevated, whereas estrogen and progesterone are kind of plateaued low. And that's what happens. That's postmenopause. And that's a normal hormone cycle. All righty. So why do these symptoms occur? It's a good question. Actually, excuse me, before I dive into that, what are just some common menopausal symptoms? So some women experience all of the symptoms that are listed here. Others may not experience any. And I've noticed, women who have one hot flash and that was it, or none. And, a smooth transition for them. Whereas I have also had patients, women and men, who, they have the whole list. They get headaches, they get dizziness, they have stiff joints, they have hot flashes, all of it. And we really don't know who is going to be symptomatic and who may not. But we can support people throughout, whatever their symptoms may be. All right, so we see changes in menses, as we talked about. So the cycles change, they became longer, more frequent, less frequent, whatever they may be. And then there are often accompanied with that, sometimes afterwards, body changes, or something that we call clinically vasomotor symptoms. Those often are hot flashes, night sweats, changes in sleep pattern, palpitations, headaches, fatigue, weight changes, vaginal dryness, changes in the vaginal tissue, and increase in urinary tract infections or pain during intercourse. Changes with hair, either thinning or more hair in other places in the body that we don't normally, maybe for some women, don't experience hair growth. And then a decrease often in bone density, not always, but that can happen as well. Accompanied with that, sometimes for some individuals, there are mood changes, and that can happen at any point. Alrighty. So I think this is just another illustration of what happens with our hormones during different phases of our life. So During that reproductive age, we see the estrogen and progesterone for the most part are fairly elevated. And then that completely flips over during menopause. So, all right. So what do we do? What do we do to support the body? And actually, before I jump to that, I just want to make a little note about back here about estrogens, and because I will go into it in a little bit more detail in a moment. But that there's 3 different types of estrogens out there. There's estrone, which is E1. We often refer to it as E1. There's estradiol, which is E2, and then there's estriol, which is E3. And I'll talk a little bit more about that shortly. But I do want to mention that there's a lot of different forms of estrogens. Progesterone is pretty simple. Testosterone is fairly simple as well. And those estrogens play different roles in the body and with our symptoms. So we'll get into that in a little bit. So what do we do to support the body? Whether that's during perimenopause, premenopause, postmenopause, what can a naturopathic provider offer? Well, a lot. And I would say first and foremost, my emphasis is often on nutrition. And I feel that often during menopause, that's really when a lot of women come in and they are interested in nutrition and they want to talk about nutrition as it may relate to their health and ways of preventing and treating symptoms or conditions that may arise during menopause. And for the most part, I talk a lot about nutrition, and I've done some talks with Northwest Medical Specialties about the anti-inflammatory diet, which is the type of nutrition model that I generally encourage for most individuals, especially during menopause. I feel that it is a really good diet to think about, or nutrition model to think about encouraging. It's a diet that is rich in whole grains, fruits and vegetables, beans, which are really, really, really important. And especially during menopause, nuts and seeds, healthy fats, and generally low in animal fats, and specifically refined sugars. And I won't talk a ton about nutrition today. If there's questions about nutrition, I'm happy to answer them. But I really want to emphasize that refined sugars, the limiting of refined sugars can help a lot with menopausal symptoms. And so I think they've recorded that anti-inflammatory talk. And so if you want to get that, I'm sure maybe Abra has that available or can direct you how to find that. Also nutritional and pharmacologic support. So this is what naturopathic providers, especially in the state of Washington, can offer. We are trained both in vitamins, minerals, and there are specific ones for this phase of life, as well as pharmacologic agents. And I kind of put hormones under that pharmacologic group, hormone use, and we do utilize that. We are familiar with it, most of us. In addition, there's glandular support. But for the most part, nutrients are very individualized, and they will be determined based on who you are as the individual and what nutrients your body needs after taking a very comprehensive exam or asking lots of questions. Some common supplements that we start to think about during this phase of life include calcium, magnesium, manganese, I want to combine the 2 words, minerals, bioflavonoids, vitamin C being one of them, and B6, which is a really important B vitamin. And during my tips and tricks, I talk about specific ones for specific conditions. Botanicals. So herbal medicine can be utilized with great success, but you have to work with someone who's very knowledgeable about herbs and herb-drug interactions. But there are botanicals. Specifically, we start to think about ones that maybe have some phytoestrogenic components that can help to restore balance to hormones and that may be circulating throughout the body. But again, you have to use some caution with certain phytoestrogens depending on your health history and current health concerns. For the most part, phytoestrogens, these herbs that contain estrogen-like properties, They are just much lower in strength than an estrogen hormone that may be given. And they can improve symptoms within 1 or 2 weeks. But again, we must use caution. There's other herbs that can absolutely be used to help support things like sleep and bone health and mood support. And so they're individualized, it's customized. Homeopathy is a wonderful form of naturopathic medicine that's been around for hundreds of years, and it has very low side effect profiles. We give it to babies and pregnant women, and there's no real side effects from homeopathy. But you have to work with someone who's very knowledgeable in homeopathy and homeopathic remedies. And it can touch on both the mental, emotional, and spiritual realms in a really, really effective way. So I love to utilize homeopathic remedies during this phase of an individual's life. And remedies, the homeopathic remedies, they are generally made from a variety of different sources, many of those sources being plants, a little bit of animal sources, minerals, etc. So they're very natural and very, very low side effect profile, and very generally safe to use and with very few contraindications. So that's a great therapy that as a naturopath I like to utilize. And then hydrotherapy, and this is water therapy. It's using water and the healing benefits of water. And this is a very, very old, also naturopathic treatment. It's used to often improve circulation, which can help by reducing blood pressure, improving sleep quality and digestion. We, as naturopaths, often use it to help with chronic health concerns that can sometimes come up all of a sudden during menopausal years. So that is another very low intervention therapy, and there's different ways to do water therapy. Physical medicine and exercise are also great tools. We, as naturopaths, we're trained in something called naturopathic manipulation, which is kind of like chiropractic, but it's a little bit gentler approach, as well as physical medicine, like physical therapy. And I know that with Northwest Medical Specialties, they have a great group of physical therapists that they work with, which are awesome. So if there are aches and pains and ailments and things coming up, it's great to utilize them. And then exercise, specifically weight-bearing exercise, is so important during this phase of life. And I'll talk a little bit more about that as we address things, some tips and tricks, and specifically how to support bone health. Weight-bearing exercise is so important. And I often tell a lot of my patients, if there's just one thing that you're going to do today, it would be exercise. It's not, if you don't make changes in your diet, if you don't drink more water, if you don't, eat more vegetables, that's okay. I'll be fine with that. But exercise, getting in movement, is so important for so many aspects of our life and for disease prevention, especially during menopause and menopausal years. Acupuncture, I'm not an acupuncturist, but it can be very helpful. And I'll talk about specifically when and when to utilize it. And so it'd be working with another acupuncturist who's knowledgeable about women's health and how to support an individual through menopause. But acupuncture can be very, very helpful, specifically with hot flashes. And then lastly, I would say counseling is key. A number of things come up during these years, and it is an opportunity for self-discovery, self-awareness. As a naturopathic physician, I'm trained a little bit in counseling, but I often refer out. And the social workers here today, they know, I think they either do some counseling and they work with other counselors in the community, so they can refer someone as needed. And I think it's really, really, really important to work through things that may come up. Alrighty, so menopause and hormones. So I get these questions all the time, so I wanted to address it here today. What's the difference between hormone replacement therapy and bioidentical hormone replacement therapy? And when do we use hormones? When would it be appropriate to use hormones, and when wouldn't it be appropriate to use hormones? So HRT is hormone replacement therapy, and BHRT is the bioidentical hormone replacement therapy that often a lot of naturopathic physicians claim to do. And the only difference, and I'm going to repeat this a couple times, is that with HRT, they base treatment off of symptoms. So do you have hot flashes? Okay, great. We will prescribe you estrogen. Okay. BHRT, they look at the symptoms, but then they also look at lab values too. And they try to get things in range to look, to have your estrogen at a certain level, or your progesterone or your testosterone, if they're going to give out those hormones at certain levels. Whereas with just plain old HRT, they don't look at labs. They don't care about labs. It's all about symptoms. BHRT, or bioidentical hormone replacement therapy, is not any different. They're not natural hormones. They are the exact same hormones that are used with HRT therapy. Again, the only difference is that with someone who's doing BHRT, they look at lab values. That is the only difference. So the sources can be exactly the same. The source for the estrogen, the progesterone, the testosterone, exactly the same. They're not from natural sources necessarily. They try to do it more in a way that's matching or would be an ideal range for an individual. They're looking for those values. So that's kind of the method I utilize. When I do hormones, I do utilize more of that BHRT model. And where I'm looking at lab values and I'm basing my decisions with the patient on their symptoms. What are their symptoms looking like? And then what are their labs telling me, and how do I best support their body? And a lot of times I don't need those labs as much as the symptoms kind of tell me where to go. But it is another tool that can be helpful. There are many different forms of hormones that are available. And I'm so sorry about the noise out there. If it's getting a little too much, just let me know, just kind of interrupt me, and I'll see what I can do. There are pill forms or troche forms, which are a little bit of like a sublingual. There are creams, there are patches, there's injections. There's many different forms of hormone replacement therapy that can be utilized. And yeah. So when do we consider using hormones? Well, the best time to start thinking about HRT is when an individual is less than 60 years old and also less than 10 years from when they went through menopause. If you start then there can be, hopefully this is going to end, 30% lower mortality rate, and there's decreased risks of heart disease if you start during that phase of life. We often don't like to start at over the age of 60, and definitely if it's been more than 10 years since the onset of menopause. And then we want to think about always using the lowest effective dose to help support whatever symptoms may be coming up, any of those vasomotor symptoms, specifically hot flashes, if we're going to use hormones, and to also help with the prevention of osteoporosis. Those are the big times to really think about it. So if there's a family history of osteoporosis or already pre-existing osteopenia or osteoporosis, hormones can be very effective as long as there's no other contraindications in place. And there are many contraindications. So it's important to utilize, to take a very thorough health history. And one of the biggest side effects and why we often don't recommend it during breast cancer is that hormones can increase the risks of thromboembolic events such as strokes or heart attacks. That, as well as different types of breast cancers, have receptors that in the body that are sensitive to estrogen or progesterone. So that's when we don't utilize hormones, and that's when it's contraindicated. There's a big contraindication there. And then there's some other contraindications too, but it can be done safely. And actually, I'll talk about it. some hormone forms, specifically certain estrogen forms, can be used with an individual who has a history of breast cancer in certain situations. And again, certain forms of estrogens can be used. And I'll talk about that in a little bit. So soy and alcohol. So what's up with soy and alcohol? Specifically, we'll start with soy. So there is some evidence that suggests that moderate soy intake may be protective against the development of breast cancer, even with those who are estrogen receptor positive. It may prevent a recurrence, but the quantity we aren't so sure about. We know that eating too much estrogenic type foods can have some negative consequences. But that there can be some protective, it can provide some protection. And generally speaking, we want to think about, if you're going to consume soy foods, we want to use traditional sources. So foods such as tofu, tempeh, edamame, miso, and avoiding highly processed soy. So, soy products that like soy milk or very processed soy, where you see soy in the word, but not quite sure what that word is or what that word means, maybe a very processed soy product, specifically a lot of the soy meats. For individuals who do not have a diagnosis of breast cancer, soy and soy isoflavones, there is some data to support consumption, and that it may reduce hot flashes by about 20.6%. So it's kind of a low effect, but a positive one. It can also be helpful with mood concerns that may come up during menopause, things like depression or depressive symptoms. It can be helpful with bone loss. But again, here there's not quite enough data, but there's some data that supports it may be helpful for bone mineral matrix. It does seem to reduce LDL cholesterol, which is the plaque-forming cholesterol. This is kind of the bad cholesterol that we think about. So consuming more soy products may help one's cholesterol levels, but it doesn't seem to change HDL, which is the protective cholesterol. So this is what helps prevent plaque from forming on the arteries. And again, as I said, it may be contraindicated in breast cancer. But the moderate amount seems to be okay. So we don't want to do an excess amount, but a moderate amount would be fine. So kind of one of my takeaways from today, everything in moderation, especially when it comes to soy and alcohol. And I'll talk about alcohol. So definitely alcohol can increase one's sleep disturbances at night, and can absolutely increase hot flashes at night. So it can disturb one's sleep. And that's often because it causes more vasodilation. It causes the blood vessels to be bigger or more enlarged. And as a result, blood flow increases to certain areas of the body. And that can cause one to sweat, as well as the liver. It takes a lot for the liver to process alcohol. So with that, what I'm going to talk about in a moment, we know that alcohol increases some of the symptoms of menopause. So less may be better, especially in regards to any sleep issues or hot flashes that one may be experiencing. But then there's some more information, specifically in relationship to breast cancer. So what the Surgeon General recommends, and what we have done, we know about with some studies, women who drink between 1 and 2 alcoholic drinks per day, so it's per day, increase their relative risk of breast cancer by 10% compared with light drinkers. So those are individuals who drink less than 1 drink a day. So I'm just going to repeat that again. That's 1 to 2 drinks per day can increase their risks of breast cancer by 10%. And then I talk a little bit more about that, what that means. So it does increase one's risk. Now, drinking between 3 to 5 drinks per week, this is associated with reduced all-cause mortality. So meaning it's potentially going to be beneficial for longevity, drinking 3 to 5 drinks per week. So, this initial, if you want to look at things, compare things, there is a 30% increased risks with relative risk of developing breast cancer if for someone who smokes 1 pack of cigarettes a day. So it's maybe, if you think about it, maybe not quite as bad potentially, 30 versus 10. But it's something that we can control. And so it's something that we can, when we're something we can control in our life, there's only so few things in reality that we can control. This is one of them, but how much alcohol we are consuming can have some really good benefits if we would drink less. And then there's some newer research out there that just came out indicating that even less is better. So you could safely say 3 to 5 drinks per week is okay, but newer research is saying less may be even better. So less is more. And if you need more information about that, what's 1 drink? So 1 drink is 5 ounces of red wine or white wine, 12 ounces of beer, 1.5 ounces of spirits. So that kind of gives you a little bit more information. So now we get into my tips and tricks. So I would say first and foremost, especially if you're someone who's experiencing hot flashes or night sweats, stop the alcohol if you're drinking a lot. That's going to help to have some really good benefits if you just limit the amount of alcohol you're drinking or stop it altogether. And first and foremost, before I jump into anything even natural or alternative, we want to think about some other ways to modify our symptoms and help our symptoms. And that can be done through some non-pharmacologic therapies. So, layer clothing, and when you're feeling a hot flash coming on, take off some of the clothes that you're wearing. Always lower the room temperature, and then avoiding dietary triggers. So that could be caffeine, alcohol. I didn't list that, but that is definitely one. That's a very common dietary trigger for hot flashes. Sugar can be a very, very, very common dietary trigger for hot flashes, as well as spicy foods. And then just carry fans, bring fans with you. Now, specifics, some other natural and alternative therapies. These are for the most part ones that I utilize with my patients who have been diagnosed with breast cancer. With black cohosh, I use use it with caution because it has some phytoestrogenic properties. So there's a time and a place for black cohosh, but it can be helpful with mild to moderate hot flashes. Just use with caution, especially if you're someone who's been diagnosed with breast cancer. But vitamin C is great. I generally recommend about 500 milligrams 3 times a day. I don't go beyond that. And if you're someone who's prone to kidney stones, that may be all you want to do. You don't want to go above that, and it may be something that you may want to avoid, especially if you have certain types of kidney stones. One of my favorite options, one of my favorite nutrients, specifically for hot flashes, and that can be very safe and effective with breast cancer, is omega-3s or essential fatty acids. So this is what we get from cold water fish, and fish like salmon, mackerel, anchovies, sardines, and herring. That kind of gives you some of my recommendations there. The only caveat, one of the caveats and cautions with omega-3 use is that it can cause easier bruising or bleeding. So if that is happening for you, you want to avoid that. And then with certain treatments, you do want to keep in mind that omega-3s may be contraindicated because they are blood thinners. So if you're on a medication that you want to avoid blood thinners on, or you're about to go into surgery, you want to take omega-3s. There's other ways to do it. And then bee pollen, actually, and honey. I totally actually forgot about this one until I was doing a little bit of research for this presentation today. I remembered that bee pollen can be really helpful for hot flashes. And luckily in the Pacific Northwest, we have access to bees and bee pollen. So that's something worth trying and probably has fairly low interactions. Acupuncture. So this is a time and place for acupuncture for sure. If you're experiencing hot flashes or other vasomotor symptoms, doing about 20 treatments within 6 months has a positive 37% in dropping or reducing those vasomotor symptoms, hot flashes being one of them. And then exercise and weight loss. So for sure, exercise. So I am a big proponent there. Now, vaginal dryness. So I have a lot of individuals that come to me with concerns around either dyspareunia, which is pain during intercourse, which may be a result of vaginal dryness. And there's a lot that can be done, and very safely too. So this is the time and place where hormones can be utilized. And even with a diagnosis of breast cancer, there are certain forms of estrogens, as I mentioned earlier. There's the 3 different forms. There's the estrone, the estradiol, and estriol. The estrone is a form that we don't utilize. It is the more potentially bad form, cancer-forming estrogen form. So we don't ever use estrone, but we do at times use estradiol and estriol. And estriol is very specific to the vaginal wall, the vaginal tissue. So you can use estriol vaginally, and it helps with vaginal dryness. And then estradiol is used in a couple different products, specifically E-string or Vagifem. The E-string is a very low dose of estradiol, and it's a string that's inserted into the vaginal canal, and it gives off a little tiny dose of estradiol that's very localized, so it does not go systemically. It stays in the vaginal wall, so the tissue of the vagina. It's great, it's safe to use, but you always want to talk to a healthcare provider about it before you start that. But it works really, really well. Otherwise, this is a time and place for lubricants and moisturizers. And there's a ton out there. There's a lot of great organic ones. And if you need some good recommendations, I can give them to you after the presentation today. But this is my little reminder for individuals that lubricants are for lovemaking. So you only want to do that during intercourse. Moisturizers are for maintenance, meaning moisturizers are, especially ones that have like hyaluronic acid or water-based, they provide some extra moisture to the tissue. These are products that would be used 2 to 3 times per week to help kind of plump up the tissue. And then vitamin E. So this is the only time I really utilize vitamin E. Vitamin E has kind of been disproved to help with hot flashes. It does not seem to help with hot flashes whatsoever if done orally. But if you do vitamin E as a suppository or intravaginally, it is super, super, super helpful for vaginal dryness. It's a great little trick. And there's some good products out there that are very, very cheap that can be really helpful. And then last, I would say bone health. So bone health is so important. And during any phase in one's life, but especially, during menopause. So these are a couple of my recommendations, just kind of very basic recommendations for bone health. I go over specific doses with calcium, magnesium, and vitamin D that have been shown to be helpful for bone, maintaining good bone mineral matrix. And then this is a time and place to think about hormones potentially if there's no other contraindications for hormone use. Hormones can be very helpful for preventing bone loss. Again, my exercise is going to be very, very important to help maintain good bone health. And I generally recommend between 20 or 30 minutes per day or 150 minutes per week. That is the recommendation from the American Heart Association for just good cardiovascular prevention. So if you're one of my patients, you've heard me say that before. But then specifically, if you add in a weighted vest while you're exercising adds a little bit of density mass on your bones, specifically the hip bones, which get affected the most. So this is a time to think about, adding this in to help maintain good bone health, especially with your hips and lower limbs. And when you do consider purchasing a weighted vest, you'd want to make sure it's at about 10% of your body weight. And you can wear that walking, walking up a hill is a great option, hiking, whatever it may be. And then of course, I like to mention this too, that Exercise also helps the brain. It doesn't just help the bones, it helps the brain, it helps the heart, it helps a lot of different aspects of one's life, but it does seem to lower dementia rates. So that's great. And then nutrition, kind of making full circle back to nutrition. There are a lot of different nutritional aspects that can be improved and worked on that will help one to make sure that they are digesting their food, they're absorbing their nutrients, they're absorbing your calcium and magnesium and vitamin D. It's not just about taking these supplements or encouraging foods that contain more calcium or magnesium, but it's also making sure that you're actually absorbing the nutrients out of your food and your diet. So specifically with bone health, what I'm looking at with my patients are how are they digesting their food? How are they absorbing their nutrients? And do we need to work on that to help you make sure you're getting in all the nutrients that you're taking into your body, whether that's through food or through supplements. Alrighty, so I think we got things done on time, hopefully. But just to kind of summarize what we talked about today, what is menopause? First and foremost, it is a normal transition. We can support it, but it doesn't need to be pathologized. And we talked about some common menopausal symptoms, a little bit about why they occur and how to best support the body. So ways to help manage symptoms and help to prevent other diseases. Osteopenia, osteoporosis being one of them, dementia a little bit, other cardiovascular health, talked a little teeny about that. And then we went through some of the naturopathic ways to support the body, things like balancing hormones, anything from diet to lifestyle, everywhere in between. Hopefully I answered maybe some questions about BHRT versus HRT. What are they? When to use them, when not to use them, and alcohol and soy. And then a few tips and tricks on the very common conditions I see, hot flashes, vaginal dryness, and bone health. And like I said, thank you so much for listening to me kind of quickly go through this talk, and being so patient in the beginning as we figured out some of the technology concerns. And I'm happy to take questions, comments, concerns, anything that may have come up or clarification. I'm sorry that things were so loud out there. And yeah, I appreciate you all for being here today and hope that this was beneficial for you.